In 2024, artificial intelligence in healthcare is already a $15.1 billion industry. But here's the real headline. By 2030, it's projected to grow by over 570%, reaching more than $100 billion globally. This isn't a quiet evolution. It's a revolution. And if you think it's something happening behind the scenes in labs or startups, think again. It's already here. Reprogramming the very foundation of modern medicine. Right now, our healthcare systems are under siege. Hospitals are overcrowded. Doctors are stretched thin. Diagnoses are delayed. Costs are spiraling. And millions of people, especially in rural and underserved communities, still don't have access to basic, consistent medical care. We're seeing a system that was never designed to handle the demands of a post-pandemic, data-driven world. But this is exactly where artificial intelligence steps in and starts to shift the equation. From models that can detect cancer years before symptoms appear, to systems that instantly scan your entire medical history to recommend hyper-personalized treatment plans, this isn't science fiction. It's already saving lives. AI is bringing precision, speed, and scale to a field that desperately needs all three. Instead of waiting days or even weeks for results, machine learning models are delivering them in seconds. Instead of treating every patient the same, AI can now help tailor care down to the molecular level, accounting for genetics, environment, and lifestyle. And instead of relying on limited human bandwidth, intelligent systems can continuously monitor patients 24/7 with zero fatigue. This is more than a technology shift. It's a fundamental redesign of how we approach health, sickness, and care. So the question is no longer if AI will transform healthcare. It's how fast and who's paying attention. Let's start with one of the most critical pieces of the healthcare puzzle: diagnosis. Every year, millions of patients around the world are misdiagnosed or diagnosed far too late. And the consequences can be life-altering. A missed tumor, a delayed heart condition, an unnoticed infection that spirals into crisis. In medicine, timing is everything. And for decades, doctors have been working with limited tools and overwhelming workloads. But AI is changing that dramatically. Today's most advanced AI diagnostic systems can analyze X-rays, MRIs, and CT scans faster than human specialists, and often more accurately. At MIT's Jameel Clinic, models like Mirai are detecting breast cancer risks 5 years before conventional methods would even raise concern. Another system, Sybil, can predict lung cancer from a single low-dose scan, without requiring any human annotations at all. These aren't just faster tools. They're pattern recognition engines trained on hundreds of millions of data points. They don't get tired. They don't overlook details. They flag what even seasoned professionals might miss. But diagnosis is only the beginning. Once a condition is identified, AI can instantly dive into a patient's complete medical record, compare it with thousands of similar cases, and help recommend treatment plans customized to that individual's biology and history. No more one-size-fits-all protocols. We're talking about dynamic care, adaptive, responsive, and grounded in data. And that personalization is key to prevention. AI isn't just helping doctors treat disease, it's helping them prevent it. Predictive algorithms can flag high-risk patients before symptoms surface. A slight change in your heart rate, an unusual pattern in your lab results, a small anomaly in your scan. The signs are often there. AI just knows how to find them. We're entering an era where diagnosis is proactive, not reactive, and it could mean the difference between a routine checkup and a life-threatening emergency. If diagnosis is the front line of medicine, personalization is the future. For decades, treatment has relied on broad guidelines, standard dosages, generic prescriptions, and trial-and-error responses. But humans aren't standard. Our genes, our environments, our lifestyles, they're wildly different. And that's exactly where AI thrives. Using deep learning models, AI can now analyze your genetic makeup, your dietary habits, your exercise routines, and even your exposure to environmental toxins, all in real time. This means instead of guessing how your body might respond to a medication, AI can predict it before you even fill the prescription. One of the most groundbreaking advances? AI-driven drug discovery. Traditional drug development is a slow, billion-dollar marathon that often ends in failure. But platforms like Isomorphic Labs, a spin-out of Google's DeepMind, are accelerating the process with astonishing results. Their flagship model, AlphaFold, cracked one of biology's biggest mysteries: how proteins fold. That discovery alone has opened new doors for developing targeted therapies at unprecedented speed. But it doesn't stop there. Other platforms are creating fully integrated recommendation engines. These AI systems look at your medical history, your DNA, your wearable data, and deliver actionable, personalized health insights. Think: what to eat, when to rest, how to supplement, and which medications you're most likely to benefit from, down to the milligram. This isn't just data. It's a digital mirror reflecting your health potential back to you. And it's changing how we think about medicine altogether, from treating illness to optimizing health. In short, we're moving from prescriptions to precision. And with AI as the engine, your body's blueprint is becoming the map for your medical future. Imagine being monitored by a team of doctors, not once a year, not once a month, but every second of the day. That's the new reality powered by AI-driven remote monitoring. Today's wearable devices are no longer just step counters or sleep trackers. They're sophisticated, AI-enhanced health companions. Devices like Empatica's Embrace 2, FDA-approved and designed to detect seizures in real time, are already proving that AI can do more than observe. It can intervene. These systems collect streams of data: heart rate variability, oxygen levels, skin temperature, even subtle changes in movement, and analyze them instantly. The goal? Catch the signals before they become symptoms. For patients with chronic illnesses like heart disease, diabetes, or epilepsy, this real-time oversight can mean the difference between a manageable episode and a hospital emergency. But AI isn't just analyzing numbers, it's bridging the care gap. Telehealth platforms are now being supercharged with AI triage tools that guide patients to the right level of care faster. Virtual assistants ask the right questions, flag warning signs, and connect patients to human doctors only when necessary, freeing up resources and reducing wait times. In regions where doctors are scarce, this is a game changer. AI-enabled telehealth is delivering quality care across borders, time zones, and economic divides. A rural patient with limited access to specialists can now receive high-level insights from AI models trained on millions of clinical cases without leaving their home. It's not just about convenience, it's about equity. It's about getting care to the people who need it most before the crisis hits. With every beat, breath, and biometric, AI is turning distance into data, and that data into action. As powerful as AI is, its rise in healthcare comes with a serious caveat, one we can't afford to ignore. Because the same algorithms that detect disease and personalize care can also reflect the worst biases in our data. If an AI model is trained on incomplete, skewed, or non-diverse datasets, its predictions, no matter how fast or advanced, can be dangerously flawed. Imagine an AI that's more accurate for one ethnic group than another, or a diagnostic tool that performs better on men than women. These aren't theoretical concerns. They're real, and they're already surfacing in clinical trials and hospital deployments. Then there's data privacy. AI needs data to learn. But whose data? And who has access to it? When a machine can process your DNA, your heart rate, and your mental health trends, the line between personalized care and surveillance becomes razor thin. That's why transparency, consent, and robust security protocols must be non-negotiable in every AI system we build. Because in healthcare, trust is everything. And yet, even with these challenges, AI's future in medicine is breathtaking. We're seeing early-stage robotic surgeons that can operate with microscopic precision, virtual nursing assistants that check in with patients hourly, tracking pain levels, medication schedules, and emotional states. AI-powered chatbots that speak dozens of languages, breaking down communication barriers in emergency rooms across the world. The question isn't, will AI become central to healthcare? It's how we guide it. Do we build it for equity, for speed, for profitability? Or can we strike a balance using AI to expand access, improve outcomes, and preserve the humanity at the heart of medicine? This isn't just a technological shift. It's a moral one. And the choices we make now will shape the care we all receive tomorrow. Stay informed. Ask questions. And keep watching the front lines, because the AI revolution in healthcare is just beginning. For more AI news and tools, visit inn.news.